I want you to take a moment and think about how much pressure your family budget is under right now. Between the rising cost of groceries, the increase in your utility bills, and the fact that basic Medicare premiums just took a huge jump this year, managing household expenses feels like a balancing act. But if you are caring for an aging parent who relies on state Medicaid to pay for their dental work, their medications, or the home aide who keeps them safe, a much bigger storm is gathering right now in May 2026. Behind closed doors, state governors and budget committees are finalizing their spending plans for the upcoming fiscal year. And because of a massive federal law change that went into effect recently, the safety net that millions of low-income seniors depend on is being quietly dismantled. For the next 25 minutes, we are going to look closely at the hidden cuts hitting the Medicaid system this month. Why a piece of legislation called the One Big Beautiful Bill Act is forcing states to choose between cutting services or dropping people entirely, and the specific things you need to do this week to make sure your parents' care isn't suddenly cut off. I see a lot of news coverage about how the economy is changing, but almost nobody is talking about the fiscal crisis brewing in our state capitals. To understand why your parents' benefits are at risk this month, we have to look at how Medicaid is actually funded. Unlike Medicare, which is run entirely by the federal government, Medicaid is a partnership. The federal government chips in a certain percentage, and your state has to pay the rest. For years, states used a clever accounting trick called provider taxes to help pay their share. They would tax local hospitals and nursing homes, use that tax money to unlock matching billions from Washington, and then funnel that money into optional benefits for seniors, like comprehensive dental care, physical therapy, and extra hours for home health aides. It was a system that allowed states like California, Illinois, Michigan, and Ohio to provide robust support for low-income families without draining their general tax revenues. But that tool is officially gone. Under the federal budget laws that took effect for the 2026 fiscal cycle, the government placed a strict prohibition on these uniformity waivers and provider taxes. They essentially told the states that they can no longer use these funding mechanisms to artificially inflate their federal matching funds. The financial impact of this change is hitting the states like a physical blow this month. Without that provider tax loop, states are suddenly facing massive deficits in their health care budgets. Estimates show that across the country, states have to find billions of dollars in new revenues just to keep their current Medicaid programs running. And since they can't print money, they are doing the only other thing they can do. They are cutting benefits. They aren't holding giant press conferences to announce these rollbacks. They are burying the cuts deep inside state budget bills, hoping that families won't realize what happened until they try to book a dentist appointment or get a prescription filled later this summer. The most immediate danger is to what the system calls optional benefits. People hear that word and they think it means things that aren't necessary, like cosmetic procedures. But in the language of Medicaid, optional simply means that the federal government doesn't legally force the state to provide it. Under federal law, a state only has to pay for basic hospital stays and doctor visits. Things like adult dental care, vision exams, hearing aids, and non-medical home care are all classified as optional. When a state faces a massive budget shortfall like the one we are seeing in May 2026, these are the very first programs on the chopping block. We are already seeing governors in several states propose severe restrictions on senior dental care and limits on how many hours a week a home health aide can spend in a senior's house. For an 80-year-old grandmother who needs regular dental work to prevent infections that could put her in the hospital, losing that optional benefit is a life-threatening change, not a luxury cut. And the pressure is only going to intensify as we look toward the end of the year. The Federal Reconciliation Law, which people are calling H.R. 1 or the One Big Beautiful Bill Act, has built-in triggers that are designed to force millions of people off the Medicaid program entirely over the next few years. The biggest structural change is the implementation of mandatory work and community engagement requirements for adults enrolled in the expansion groups. While these rules are targeted at younger, able-bodied adults, the bureaucratic paperwork required to prove an exemption is going to trap a massive number of seniors and disabled individuals. The law states that these work requirements will officially condition eligibility starting on December 31st, 2026, but the administrative systems to track this are being rolled out right now. States are already starting to send out massive eligibility verification packets to every single person on their Medicaid rolls. They are demanding proof of income, proof of residency, and medical documentation to justify why a senior should be exempt from the new work mandates. I genuinely find it terrifying that the system is putting the burden of proof on a population that is often dealing with cognitive decline or physical limitations. If your parent receives one of these packets in the mail this summer and doesn't return it with the exact right signatures within 30 days, the computer system will automatically terminate their coverage. They won't care that your dad is 85 and has Alzheimer's. The system only sees a missing form, and the coverage vanishes. This is the paperwork cliff of 2026, and it is estimated that over 5 million Americans could lose their health insurance over the next 2 years, simply because they couldn't navigate the red tape. Let's look at a realistic scenario that is happening to caregivers right now to show you how these budget cuts hit home. Imagine a daughter named Michelle who is caring for her 79-year-old mother, Clara. Clara lives in a state that used the provider tax loop to fund an excellent long-term home care waiver program. Because of that program, a personal care aide comes to Clara's house for 15 hours a week to help her bathe, prepare meals, and make sure she takes her heart medication safely. This support is the only reason Michelle can keep her full-time job and avoid moving her mother into an expensive nursing home. This week, Michelle went to log into her state's Medicaid portal to confirm her mother's schedule for June. She found a notice stating that due to federal funding realignments under the new 2026 budget law, the state had implemented an immediate cap on all non-medical waiver hours. Clara's 15 hours a week were automatically cut to 5. The insurance representative told Michelle that if she wanted more hours, she would have to file an appeal and prove that her mother was at immediate risk of institutionalization, a process that takes months. Michelle is now stuck in a financial vice. She can't quit her job. She can't afford to pay $25 an hour out of pocket for a private aide. And she knows her mother cannot be left alone for 10 hours a day. This is the reality of the 2026 Medicaid cuts. It isn't a theoretical debate in Washington. It is a crisis that forces families to make impossible choices in their own living rooms. What makes this situation even more urgent is the larger financial environment we are navigating this year. We already know that the standard Medicare Part B premium jumped to over $200 a month, and the deductible is up to $283. If your parent is dual eligible, meaning they have both Medicare and Medicaid, Medicaid is supposed to pay for those deductibles and copays. But if your parent gets dropped from Medicaid during one of these summer audits, or if your state eliminates the optional program that pays for Medicare premiums, that $200 bill lands right back on your parent's kitchen table. Suddenly, their fixed Social Security check shrinks by 10% overnight just to cover their basic doctor visits. You are being told by the mainstream media that the system is getting more affordable because there is a new drug cap. But a cap on medications doesn't help you if you lose the state insurance that pays for your primary care. So, how do you handle this if your parent relies on Medicaid to survive? I want you to initiate a specific 3-step defense plan this week. First, you need to verify your parent's current Medicaid tier and check for any outstanding review notices. Do not wait for a letter to show up in the mail, because mail gets lost, or your parent might mistake an official state packet for a piece of credit card junk mail and throw it in the trash. Log into your state's Department of Health and Human Services portal or call their local caseworker directly. Ask them explicitly, is this account in good standing, and when is the next mandatory eligibility review scheduled? If they tell you a review packet was sent out in April or May, Demand that they email you a digital copy immediately so you can verify the details before the deadline passes. Second, you need to build what I call a Medicaid evidence file. Because states are actively looking for reasons to reduce their enrollment numbers to balance their budgets, your documentation has to be flawless. Collect your parents' bank statements for the last 12 months, their current Social Security award letter, their housing or rent receipts, and a list of all their current diagnoses from their primary doctor. If your state is one of the ones implementing the early phases of the work requirement tracking, you need a signed, formal letter from a physician stating that your parent has a permanent physical or cognitive impairment that prevents them from engaging in any community service or work activities. Having that doctor's letter on file before the state asks for it is the best way to short-circuit an automatic computer termination. Third, look closely at alternative local programs if your state does cut your parents' optional benefits. If your parent loses their dental or home care hours this summer, contact your local area agency on aging. While state Medicaid programs are cutting back due to the federal provider tax ban, many local counties have separate older adult levies or senior trust funds that are funded by local property taxes. These local programs are not bound by the federal H.R. 1 restrictions, and they can often provide bridge services like mobile dental vans or emergency home respite care completely free of charge for low-income seniors. It takes some digging to find these hyper-local resources, but in a year of massive federal and state pullbacks, they are often the only safety net left standing. I also want to warn you about a very specific type of fraud that has exploded this month because of the budget confusion. Scammers are watching the state budget debates, and they know that millions of families are worried about losing their Medicaid. In the last few weeks, we've seen a rise in sophisticated phone scams where the caller ID is spoofed to look exactly like your state's Medicaid or Social Services Department. The scammer calls and says, "We are doing the mandatory 2026 eligibility audit under the new H.R. 1 law, and we see that your parent's file is missing a verification signature. If you do not give us their Social Security number, their Medicare number, and their bank account details right now over the phone, their health care benefits will be canceled at midnight." Because caregivers are terrified of losing coverage, they hand over the information. I genuinely find it sickening that these predators are using official policy changes to terrify vulnerable families, but you have to be the shield. Tell your parents, no legitimate state caseworker will ever call you out of the blue and threaten to cancel your coverage by midnight unless you give them a bank account number. If a call like that comes in, hang up immediately. Block the number and call the official customer service line listed on the back of your parents' actual Medicaid card to check their status. We keep coming back to the reality that the entire senior health care system is undergoing a painful contraction this year. The federal government is trying to rein in spending after years of high inflation, and the states are the ones caught in the middle. The loss of the provider tax tool means the era of easy Medicaid expansion is over, and we are moving into a period of aggressive auditing and benefit reductions. It is a heavy burden for family caregivers, and frankly, it isn't fair that you have to act like a forensic accountant and a health care attorney just to keep your mom's home aid or dental care active. But in 2026, being informed is your only real protection against a system that is increasingly using red tape to balance its books. I want to hear from you in the comments below. Has your state started sending out these new eligibility review packets yet? Have you noticed a drop in your parents' approved home care hours or a change in what their Medicaid plan covers at the dentist this month? Sharing your real-world experience is what makes this channel work. It helps us map out which states are cutting the deepest and gives other families a warning of what might be coming to their mailbox next week. We are building a community of advocates here, and your voice is the most important part of that fight. We are living through a very volatile year for older Americans, And staying ahead of the paperwork is the only way to protect the people who raised us. Keep your documents organized. Don't ignore those official-looking envelopes. And don't take a computer-generated denial as the final answer if your parent has earned these benefits through a lifetime of citizenship. Protect the paperwork. Verify those state review deadlines before the summer rush begins. And always ask one better question before the next decision. Taking these 25 minutes today to understand the hidden Medicaid cuts is the best step you can take to keep your family's care safe this summer. I am so glad you spent this time with me. I will see you in the next guide.